Former Phillies manager Charlie Manuel is having a health crisis. A couple of hours ago, the Phillies announced Manuel suffered a stroke today while undergoing a medical procedure in a Florida hospital.
When patients are undergoing cardiac procedures, stroke is probably one of the higher risk factors. Hi, Dr. Erol Veznedaroglu here from Global Neurosciences Institute. I'm a cerebrovascular endovascular neurosurgeon that specializes in stroke and all treatments of neurovascular disease. So this morning we're here to talk about Charlie Manuel, the previous manager of the Philadelphia Phillies, and his recent stroke. We got a lot of questions about, what happened, how did it happen? And, obviously we don't know all the details, but what happened to him in the hospital undergoing a procedure, which I would assume to be cardiac, and again, we don't really know the details, is not an uncommon event. When patients are undergoing cardiac procedures, stroke is probably one of the higher risk factors. Patients that are undergoing open surgery, they will go on bypass, where basically they'll interrupt the beating of the heart while they're working on it. And during that time, air bubbles, clots, things like that can affect the brain. The endovascular procedures, where people are undergoing valve replacements, angioplasty, stenting, again, it's the same idea where a clot can dislodge from a valve, from the heart, go upstream and into the brain and cause a stroke. One of the other more common causes of stroke during medical procedures are patients often are on blood thinners for either stroke risk factors, cardiac risk factors, and they're blood thinners, either aspirin, Plavix, Xarelto, a whole host of different types of antiplatelet blood thinning agents are usually stopped. So anytime an invasive procedure is going to be performed, from something as simple as a colonoscopy to abdominal surgery for, GI issues, the blood thinners are stopped. And at that time, patients are at increased risk for stroke. So it sounds like he is recovering. Take-home message here is that, stroke is a very prevalent disease, and during certain procedures, particularly cardiac procedures, stroke risk goes up. The more invasive the procedure, the higher the risk. And even common procedures, stopping any type of anticoagulation or antiplatelet agents, as simple as a baby aspirin, can carry risk with it. So it's really important that if you are undergoing any type of procedure and you're on these agents, or you're undergoing any cardiac procedure, you really talk at length with both your treating physician, but also your primary care physician as well.